Errors at errors.
Okay, thanks, Tom. So I would think one phrase that Lou Valdez from FDA in our session just before lunch used, I think, kind of encapsulates what this session was about, and that's connect the dots. So it's about all of the four speakers gave ideas about how to bring together all of the issues and challenges of harmonization and offered ideas of how we could consolidate and move forward with some new types of harmonization or convergence processes. Ray talked about what I would call, I guess, a supranational harmonization initiative. He used the aviation industry global product safety as an example, and asked why can't we do the same for health products. And in his ideas that he put forward, he talked about three things: the importance of governance, of resources, and of using a sort of a two-tiered platform where we would have working groups that might be regional to address the more sovereign issues of locality. And Lou Valdez talked about what I would say a three-stepwise approach to connect the dots, and they were: one, she offered the idea of beginning with where we are now as far as some of our strongest harmonization initiatives within standards and within the ICH, for example, and then move up to, after discussing and trying to harmonize those, move up to implementing them, and some coming up with ideas for a platform that would implement them. And then finally, the important need for information sharing and communication, which we've heard throughout the last day and a half. And she also talked about the importance of making a business case model and creating a safe harbor where everyone can feel comfortable in exchanging their ideas. And David from the WHO talked about advocacy. I think that was something that was talked about by a couple of speakers in our group, which was the importance of making the case and doing this in clear speak so that others outside the regulatory realm understand what we're talking about when we're talking about plans for harmonization and the value that it brings to introduction of global products. And he talked about incentives that were going to be necessary to invest in these harmonization initiatives. And I think a topic that was discussed by Lembit and by our group was also the importance of, when we're talking about capacity building, which is so important to products that are going to be introduced into the developing and emerging countries, this is not a one-size-fits-all. We have to see what is the who, what, and where of capacity building for each region. And Vincent. So Vincent is actually the one who coined the term "one size does not fit all" and talked a lot about value added. He also talked about advocacy and the importance of describing it in clear language, that every regulatory agency in the world cannot be like the FDA and EMA, that there needs to be a willingness of the stronger regulatory authorities to participate actively and to champion these harmonization initiatives. But it's also the responsibility of all of the regulatory agencies of emerging and developing countries to define what they want. And I think Margaret Segundo also mentioned this in her Q&A period. And I think that's about it. There was just, in the Q&A period, I think Joan talked about the importance of identifying core principles of the existing harmonization initiatives. So we have sort of a framework that we can start from, and others can understand what they're doing and why they were formed. And then Mike Ward, again, talked about the need for not to work in silos, but we need a big picture. And I think I'll end with that, and I think that's what we hope to carry forth from this, the discussions over the day and a half is to try to come up with the new ideas and gel together all of these interesting ideas. So thank you.
Great. Thanks, Mike. So you've heard from our session chairs about what they found important in their sessions. We'd love to hear from you about which of those ideas you found important, particularly worth bringing forward, items they may have left out, questions for these panelists. So if, again, we have a half hour for a discussion. If you could line up behind the microphones, again, introduce yourself before your question, and we'll move forward. Anybody but Joan. Just kidding. Joan, please.